in Kenya now and tomorrow. Thank you very much. Congratulations.
Watu wa Nairobi, ningependa tupigie Lea makofi tena kwa sababu SIF, which is the Children Investment Fund Foundation, wametushikilia mkono sana kwa ile mradi yetu ya dishi na county. Mradi ya dishi na county, SIF wametuchangia na watu wetu wanadishi. Si wanadishi? Tupigie makofi Lea jameni, please. And please thank your executive director and the entire team at SIF. We appreciate everything they are doing for the people of Kenya. Mwacha sasa nimwalike mwenyekiti wa kamati ya afya katika bunge la kitaifa, Mheshimiwa Bukose, aje aseme machache. Tumpigeni makofi, the chairman of the Health Committee of the National Assembly.
Your Excellency, President and Commander-in-Chief, Dr. William Samoei Ruto, Your Excellency the Deputy President, and all protocol observed. Afya yetu, asanteni sana. Mimi kwa niaba ya kamati ya afya ya bunge letu la kitaifa, tulikuwa na wakati nimepata memorandum kutoka kwa Community Health Workers Association na mambo yenu tukaweka manani, na tunapotunga sheria vile rais amesema, saizi tuko na bills mbili ambayo iko katika National Assembly. Sheria ambayo ni Social Health Insurance Fund ambayo inatoa funds tatu: Primary Health Care, Critical, Chronic and Emergency Diseases Fund, na pia Social Health Insurance Fund ambayo itashughulikia afya wa Kenya right from the bottom mpaka kule juu, kulingana na vile rais amepanga mambo ya afya katika jamhuri yetu ya Kenya. Na sisi leo katika kule bunge tuko na malizia mambo ya public hearings, na kufikia kesho we shall table the bills pamoja na ile ya digital health bill ambaye itahakikisha kwamba yale mnafanya kule mashinani, agency ambayo itahusika naye itaweza kuyaweka katika health information system yetu na kuona kwamba yote yanafanyika na yanaweza kuwekwa na mtu yote anaweza kaangalia mambo ya afya katika jamhuri yetu. Kwa hayo mengi, nataka kuwatakia kila laheri watu wetu wa community health promoters. Mufanya kazi mzuri, msaidie wa Kenya ili tuweze kuangalia afya ya taifa letu. Asanteni sana, Mungu awabariki.
Asante sana mwenyekiti wa kamati ya afya katika bunge la Senate, Governor Senator Mandago. Tupigeni makofi akija.
Your Excellency, the President of the Republic of Kenya, Your Excellency, the Deputy President, all protocols observed. Your Excellency na wananchi, kwanza kabisa kama bunge la Seneti, Your Excellency, nataka kusema tuko tayari kupitisha mswada ambazo siko katika bunge la Seneti. Tuko na mswada ya Facilities Improvement Fund Bill ambaye itaipa nafasi hospitali zetu kwa zile fedha ambazo zinaenda kwa hospitali siweze kutumika kwa hospitali. Na mimi nataka kusema Your Excellency, kwa hiyo mswada itatusaidia sana. Hata wale wadhamini watatuma fedha kwa minajili ya afya, itatumika kwa afya pekee. Pesa za hospitali sasa haziwezi tumika kwa mambo ya barabara ama mambo ya stima, itakuwa pesa za kutumika katika hospitali. Ya pili, tuko na Primary Health Care Bill ambayo pia tunashughulikia, na tunajua ndani ya wiki moja tutakuwa tumeweza kupitisha kama bunge la Seneti. Kwa community health promoters wetu, nyinyi ndio watu ambao watabadilisha mambo ya afya katika taifa la Kenya. And Your Excellency, mahali tunarudi ni mahali afya ya Kenya itasonga mbele. Tukiwa watoto katika shule, tulikuwa na kila Wednesday ilikuwa Dental Health Wednesday, ambao wanafunzi walikuwa wanafunzwa bila ya kuchunga afya ya meno, na hii sasa inarudishwa ile prevention, na Waswahili wanasema ni bora kuzuia kuliko kuponya. Kwa hivyo nyinyi kama community health promoters, sisi kama bunge tutahakikisha mswada hiyo imepita, mambo ya yenyu ya stipend itakuwa katika sheria, na kwa hivyo mtakuwa mnapata kwa wakati kupitia serikali kuu na serikali ya county. Your Excellency, bunge la Seneti iko kule Turkana kwa bunge mashinani, na kule Turkana pia tutashughulikia hizi bili mbili kufikia Thursday tutakuwa tumepitisha, kwa sababu tumeweka program ya kuhakikisha bili zinapita iwezeshe UAC kufaulu. Ya mwisho, kwa Wizara ya Afya na wizara na serikali za kaunti, sisi kama bunge tuko tayari kufanya kazi na nyinyi kwa karibu sana, ili kuhakikisha yale ambayo tulijifunza wakati tulijaribu kuimplement UAC na hii kufaulu, tuweze kufaulu sasa. Governors ambao wako safari, Your Excellency, mimi nataka kuambia kama former governor, wako na bahati sana. To be a governor in this era, where we have a government that believes in devolution, starting from the president and the deputy president himself, to have a national government that sends money to counties on time. I want to tell you, ladies and gentlemen, you are the most fortunate governors we have in this republic today. It is up to you and your teams and us to support you to make sure that for the first time, UAC succeeds and succeeds for life in this country. Thank you very much.
Thank you very much. Sasa nitamwalika mwenyekiti wa baraza la magavana ama ni kongamano la magavana, Gavana Anne Waiguru, atoe hotuba yake na pia atambulishe wale magavana wote ambao wamefika. Welcome, Governor.
Your Excellency, the President of the Republic of Kenya, Your Excellency, Dr. William Samoei Ruto, Your Excellency, the Deputy President, Rigathi Gachagua, Your Excellency, Madam Dorcas Rigathi, Your Excellency, the Prime Cabinet Secretary, Musalia Mudavadi, Excellency, Governors present, CES for Health, and other colleagues from the national government, Ministry of Health and other ministries and state agencies present, representatives of CSOs, private sector development partners, county government officials, ladies and gentlemen. Afya yetu, jukumu letu. I would like to request Your Excellency, before I make my very brief remarks, to introduce Excellency governors who are present here, and we'll just ask them to stand up as we call their names and wave to the crowd. Your Excellency Muthomi Njuki, Governor Tharaka Nithi and Chair of Health, Excellency Susan Kihika, Governor of Nakuru, Excellency Wamatangi, Governor of Kiambu, Excellency Mohamed Mohamud, Governor of Marsabit, Excellency Governor Cecily Mbarire, Governor of Embu, Excellency Jonathan B., Governor Uasin Gishu, Excellency Simba Arati, Governor Kisii, Excellency Lusaka, Governor Bungoma, Excellency Otuoma, Governor Busia, Excellency Kahiga, Governor Nyeri, Excellency Badilisha, Governor Nyandarua, Excellency Kachapin, Governor West Pokot, Excellency Wanga, Governor Homa Bay, Excellency Kawera Mwangaza, Governor Meru, Excellency Governor Khalif Mandera, Excellency Barchok, Governor Bomet, Excellency Natembea, Governor Trans Nzoia, Excellency Wesley Rotich, Governor Elgeyo Marakwet, Excellency Governor Mutula, Governor Makueni, Excellency Wavinya Ndeti, Governor Machakos, Excellency Malombe, Governor Kitui, Excellency Issa Timami, Governor Lamu, Excellency Guyo, Governor Isiolo, and Excellency Mwadime, Governor Taita. I think those are the Excellency governors present. And I'm very grateful kwa vile mumewakaribisha. Oh, na Governor Sakaja, Governor wa Nairobi. Aya, alikuwa tayari ameshaongea, naomba radhi. Today, Your Excellency, marks a historic occasion in the pursuit for better health and well-being of Kenya's citizens. As you know, county governments greatly value the health workforce and recognize that this important resource is central to the delivery of quality health services. In this regard, Your Excellency, county governments and the devolution family at large is here to celebrate this launch of our Community Health Promoters Program. Let me take this early opportunity on behalf of the Council of Governors, county governments, and on my own behalf to thank you for making time off your busy schedule to be here with us on this important and momentous occasion. Your Excellency, we applaud you for prioritizing the health agenda, especially strengthening primary health care. This is the heart of universal health coverage. Your presence here underscores the importance of this program and its potential to transform the health landscape in Kenya. The return on investment in community health is well documented, and when implemented, this has a ripple effect to all social pillars of our nation. Your Excellency, the CHPs being launched here today will be a driving force behind healthier communities, and their work will undoubtedly reduce the burden on our healthcare system by preventing diseases, promoting healthier lifestyles, and providing vital support. As such, county governments remain fully committed to supporting the CHP program through allocating resources that will match national government allocation. As you may already know, most counties already allocate over 30% of their total county budgets to health, despite having 14 devolved functions. Some of these resources support primary health care. Your Excellency, we know that this launch is just a beginning of a long journey, since we must ensure that all CHPs are well trained in various modules, facilitated with kits, motivated and retained. I hereby seek to urge the support of all stakeholders, including our local and international development partners, to prioritize community health as a key contributor to universal health coverage. We need both technical and financial support in actualizing this noble cause. In conclusion, Your Excellency, ladies and gentlemen, today's launch of the Community Health Promoters Program is a testament to our government's dedication to the health and well-being of its citizens. We are deeply grateful to Your Excellency, President William Samoei Ruto, for your visionary leadership and commitment to this cause. Together with the county governments, we will work towards a healthier, happier, and more prosperous community for all. I thank you. Afya yetu, jukumu letu. Asanteni.
Asante, mpigeni huyo makofi, ni mdosi wetu kwa COG. Your Excellency, allow me to also just give apologies from our women rep, Mheshimiwa Esther Passaris, who's traveling, and she asked me to give apologies, as well as the Senator of Nairobi, Senator Sifuna, also asked for, he's in Turkana with Senator Mashinani. At this point, allow me to invite Cabinet Secretary for Health, Mheshimiwa Susan Nakumicha, to come give her remarks. Tumpigeni makofi. Mama wa nguvu.
The President of the Republic of Kenya, who is also our country's Chief Vision Officer, His Excellency Dr. William Ruto, the Deputy President, His Excellency Gachagua, the Second Lady, the Prime Cabinet Secretary, colleague Cabinet Secretaries present, Excellency Governors present, Principal Secretaries present, elected and honorable members, to our Healthcare Foundation and Army the community health promoters. Afya yetu, jukumu letu. Asante sana. Your Excellency, this is a momentous occasion as we live up to the promise in the Kenya Kwanza plan. The flagging off of our community health promoters kit is the actualization of a cherished vision, a vision that resonates with the ideals of universal health coverage and community well-being. We will only achieve UHC through strengthening primary health care, afya mashinani, and empowering community health services, which we rightly call afya nyumbani. As a ministry, we aim to promote health and prevent diseases rather than fighting them, which will in turn address the increasing healthcare costs. The shift from curative to preventive and promotive care is not only a smart investment, but also a guarantee massive healthcare improvements across the 47 counties. Many countries around the world have recognized the significance of strong primary healthcare systems. Countries like Mexico, Brazil, Bangladesh, Thailand, and Korea have made remarkable progress in expanding access to healthcare through community health workers. They serve as examples, Your Excellency, that we model and align with our Afya Nyumbani initiative. And I thank you, Your Excellency, for the opportunity to be at Harvard 2 weeks ago to meet with the ministers of these countries. As a ministry, our mission is to ensure we build a healthier, more resilient Kenya. This commitment rings true in Kajiado as it does in Kacheliba. This commitment is true in Homa Bay as it is in Elgeyo Marakwet and in Nyeri County. These kits today, Your Excellency, will go to elevate the health burdens in Trans Nzoia County as they will in Tana River County, to improve wellness in Laikipia, Loichogio, and Lamu. We hope that they will help Kenyans to receive early diagnostic and referral care from the comfort of their homes and villages nationwide. Your Excellency, community health services stems from the inherent right of every Kenyan to access quality and affordable health care. It is a demonstration of active pursuit of a healthier nation. With an estimated 10 million households, our strategy for outreach is to leave no one behind. To ensure that we understand this, allow me, Your Excellency, to help all those who are slow learners like myself and have difficulty with numbers and figures, except when they are dealing with money, Your Excellency. Most people, when there is a 10-cent reduction in their M-Pesa, and the CEO of Safaricom is here, will tell you, they will know Safaricom imekata shilingi zangu 10. But in this case, Your Excellency, 10 community health promoters, each is tasked with 100 households. That means 1,000 households, Your Excellency, form one community health unit, which we call the CHU. And this CHU, Your Excellency, is headed by a community health assistant that we refer to as the CHA. This will establish approximately 10,000 community health units in the country. These units are the bigger part of a larger primary care network, PCN. This means that each unit is linked to a specific level 2 health facility, commonly known as dispensary, and a level 3, commonly known as a health center. These facilities are mapped to level 4 facilities, such as sub-county or county hospitals, and we are creating a hub and spoke model where the level 4 facilities serve as the central point. Your Excellency, I would like to thank you most sincerely for the pressure that you mounted on me, the continued support and leadership that you have given to the health sector as one of your key priority agenda. Many times I met Senator Aaron Cheruyot, and he asked me, in 100 days, kila mtu atakuwa na afya. Today I'm proud that we begin this process. I want to thank our governors. Thank you for honoring our invite. You are the custodians for the primary healthcare agenda. I acknowledge and laud your immense collaboration and goodwill as we continue together. Asanteni sana. But please note, we are in this together, let's do it. To the health committees in both houses, your support by running checks and balances at Ministry of Health in delivering UHC cannot be underestimated, especially now as you midwife the new bills into acts of parliament that shall form the governance structure for UHC. As a ministry, I want to thank the partners who have worked with us. I want to acknowledge CIF, to acknowledge World Bank, to acknowledge CDC, UNICEF, AMREF, PATH, WHO, USAID, Safaricom, and all the development partners for the immense support. Your Excellency, I have two very hard-working principal secretaries. I truly want to acknowledge them today for the work they have done. PS Mary Mudhoni, PS Harry Kimtai, asanteni sana. Your Excellency, allow me to single out Dr. Maureen Kimani and Dr. Salim Hussein, who have been globally recognized for their efforts in community health. In Dr. Salim's word, Your Excellency, today feels like his wedding day. Asante sana, Your Excellency. And lastly, thank you to my chief advisor, my technical advisor, the Director General, Dr. Amoth, and the entire team of Ministry of Health who are looking at us across our headquarters. Asanteni sana, team. Your Excellency, now I would like to recognize our cherished women and mothers across the country, who by default are the first doctors and nurses and clinicians when a family member falls sick. I honor their involvement in the day-to-day attempt to provide health care at home. As a fellow mother, and our second lady is here with me today, we'll agree that mothers are the bedrock of community health promotion, and we'll involve them as much as possible in Afya Nyumbani together with our community health promoters. Your Excellency will agree that if you are at home and you started to cough, I'm sure your mother will stand with either a fist at your back just to check what's wrong with his son. And I'm sure Mama Rachel will ask, do you need some hot water with honey or with lemon? Your Excellency, that is what mothers are. We are born inherently as doctors. As I conclude, let me remind the country that the theme for this year's Mashujaa Day celebration is universal health coverage, and the celebration will run from 13th to 20th October. Allow me to welcome you all to the green and splendid county of Kericho for our celebrations and the launch of the UHC program that shall be graced by His Excellency the President. Kenyans, together we can make quality health care accessible to every household, every individual, and a secure, brighter, healthier future Kenya lies ahead of us under His Excellency, the President of the Republic of Kenya, William Samoei Ruto. Asanteni sana. Your Excellency, I want to take this opportunity to now invite the Prime Cabinet Secretary to make some brief remarks.
Mheshimiwa Rais wa Jamhuri ya Kenya, Dr. William Samoei Ruto, Naibu wa Rais, Mheshimiwa Rigathi, Madam Dorcas, mawaziri, magavana, viongozi wote ambao wako hapa na haswa wahudumu wetu ambao watakuwa kwa mstari wa mbele kupambana na mambo ya afya. Mheshimiwa Rais, miakilishi wetu wa kitaifa walisema kwamba wana changamoto 3 ambazo ni lazima tupambane nazo. Changamoto ya kwanza ni umaskini. Changamoto ya pili ni kupambana na ujinga, na changamoto ya tatu ni kupambana na ugonjwa. Kwa hivyo tukiwa hapa, hawa wahudumu ambao wako mbele yetu na wengine wakiwa katika sehemu mbalimbali za kitaifa wanaidhimisha kwamba tangu tuanze hiyo safari, hizi changamoto bado zinatusumbua. Changamoto ya kwanza ya umaskini, Mheshimiwa Rais, unapambana nayo na pia umeweka ile hustler fund ambayo ni ya kusaidia mambo ya kiuchumi. Kwa mambo ya elimu, serikali yako imetoa budget ambayo haijawahi kuonekana ya bilioni zaidi ya 630 kupambana na mambo ya ujinga, kuelimisha watu wa Kenya. Na sasa tuko hapa wewe kuzindua nafasi hii, wahudumu wakipata vifaa vya kutumia kusaidia jamii zetu. Hiyo ni heko kubwa kwa hii miaka 60 ambayo tumekuwa huru, na tunataka tuseme kwamba tuzidi kuwa kitu kimoja chini ya Rais wa Jamhuri ya Kenya, tukishirikiana na magavana wote ili taifa letu lipate nafuu. Asanteni sana, na sasa ni jukumu langu nimwalike Deputy President naye aje aseme. Asante.
Your Excellency, the President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, I've chosen to speak from here because there has been serious breach of protocol. The state podium is reserved for the head of state, but I want to exonerate all those who have spoken there because it is the President himself who invited them to speak from there and breached protocol. And as a man who was in uniform, I politely declined the invitation by the President to break protocol, and I will speak from here. And you know, those of us who work around the President, we have a very difficult task of overseeing the transformation of a hustler into a president. That is why the President is breaching protocol, because much as a hustler nation propelled one of them to State House, it is very difficult to get the hustler out of him. And that is why he is quite comfortable to get everybody to use the state podium. Your Excellency, our President, today is a very important day for this country and for your administration. Among the 5 key pillars is the universal health coverage. And Your Excellency, I want to tell the people of Kenya that what is happening today is not by accident. It is 1 year of hard work by the President, and I want to confirm the President has held countless meetings, day and night, with officials from the Ministry of Health, our international development partners, and other stakeholders. And Your Excellency, this intervention at the level 1 of intervention is a clear demonstration that you are determined to transform this country through the bottom-up economic transformation agenda. That is why this intervention is at the lowest of the pyramid, mashinani, where wananchi are. Your Excellency, it may look expensive at this stage to provide the equipment and to give stipend to the community health promoters. But Your Excellency, you are well informed that this is short term. Going forward, the cost of preventing a disease is 9 times to cure the same disease. So this is a temporary measure, and in 5 years' time, through this intervention, the cost of curing diseases in this country will come down by 50%. So again, this is an intervention that is geared towards the economic transformation of our republic. For the health care promoters, I want you to pray for President William Ruto, because for many years, nobody has ever remembered you for the voluntary work you have been doing. Our president, because of being a grassroots person and understanding the ground and the people down there, was quite aware of the struggles our promoters have gone through by volunteering their services, yet their families to feed. Your Excellency, continue listening to the bottom. Continue listening to the grassroots people. And that is how you are making decisions that are well informed and grounded with the ordinary wananchi. As I wind up, before I call the president, the governor of Tharaka Nithi talked about El Nino. The meteorological department has told us that now they have scientific information that we shall have El Nino. And Your Excellency, further to your directions, I have convened this Thursday at 10 a.m. the National Emergency Response Committee, so that we can now discuss the level of preparedness so that we don't get caught flat-footed, and we prepare as a country how to deal with the expected emergencies arising out of El Nino. In that meeting, Your Excellency, we have called the Ministry of National Treasury because of the financial implications, the Ministry of Water and Sanitation, the Ministry of Environment, the Ministry of Agriculture and Livestock Development, the Ministry of ASAL, the Ministry of Interior, the Ministry of Health, the Meteorological Department, the Drought Management Authority, the Kenya Defense Forces, the National Police Service, humanitarian agencies like Red Cross, international organizations, our development partners, and most important, all the 47 county governors, because in one way or another, they'll have to work with the national government to deal with the various challenges that will come with El Nino. The governors who are here, you'll find a formal invitation when you go back to the office, but this address forms again as a way of inviting you to create time and come for that meeting. The governor, Nairobi, is very critical. There are drainage challenges in this city and other cities of Mombasa, Eldoret, Nakuru that we need to prepare. We need to work together between the national government and the county governments so that as a country we prepare for the challenges that will come with El Nino, and we have sufficient information to the people of Kenya, those who are on high ground, those who are in areas that are prone to floods. There is adequate information to the people of Kenya so that everybody can get prepared to deal with the expected emergencies and challenges that may come with El Nino. With those very many remarks, I now want you to stand. We invite our president to the state podium to address the gathering and the people of Kenya. Karibu Mheshimiwa Rais.
Asante sana. Tafadhali tuketi chini wale wako na viti. Pongezi sana Bwana Rigiji. Tumpigie makofi kwa kuongea Kiingereza kizuri. Na nimeona, najua nimesumbuka sana hapa chini. Alikuwa hawa wazungu wakiongea na niuliza huyu amesema nini? Huyu amesema nini? Sasa na nimemsaidia sana, naeleza huyu amesema hivi. Sasa amesimama hapa ameongea tena ile Kiingereza, nikashangaa sasa huyu mtu kumbe alikuwa ananienjoy. This is a very special moment in the history of public delivery in our country. For decades, success in relieving citizens of the huge burden of human suffering and financial distress caused by illness has been elusive. The main reason for this is that our health system devoted itself exclusively to the provision of curative services and primary health and gave minimal attention to prevention and promotion of health interventions that begin at home, often before the onset of serious illness. At the consultative stage of the process by which we formulated the bottom-up economic transformation agenda, Kenyans made it very clear to us that the transformation of our public health care model was long overdue. Despite appreciable progress in enhancing the availability of healthcare infrastructure, technology and personnel access to curative health remained difficult, and the cost so high that many thriving households have been plunged into serious financial trouble by the illness of a single family member. 36% of our citizens are at risk of being impoverished by the catastrophic financial burden of serious illness. And in fact, statistics show that 1 million Kenyans every year sink into poverty because of chronic illnesses of their family members. Kenyans, therefore, expressed their yearning for a new approach to healthcare, one that saved costs, simplified the means of actualizing the fundamental constitutional right to the highest attainable standards of health set out in Article 43(1)(a), and we met them directly halfway at their point of need. We agreed that a community health approach is the foundation of preventive health care, mainly because 70% of cases attended to in our hospitals are preventable. At the same time, every shilling invested in community health has a return of 9 shillings saved in curative healthcare costs. We committed, therefore, to employ community health promoters as a critical component of the national primary healthcare system, in addition to employing 20,000 healthcare workers. These are doctors, nurses, clinical officers, laboratory technologists, physiotherapists, and others to bring the ratio of healthcare workers to the population to 23 for every 10,000 as recommended by the World Health Organization. The case for primary health underpinned by a well-resourced community health system at the very bottom is overwhelming. This is why our community health has received strong support from both levels of government, providing an opportunity to showcase a transformed approach to collaboration between the national and county governments. Our journey to deliver this commitment is now well underway. Today, we strike out in the new direction to execute a paradigm shift in the way we serve the people of Kenya with regard to their healthcare needs. Kenyans will now be attended to at their homes by fully trained, homegrown community health promoters who shall be supervised by qualified health workers. And I am very proud that we have 7,000 plus just for Nairobi County. And I want to say congratulations to all of you for what you are already doing for our communities. The community health promoters are facilitated to provide a defined package of preventive and promotive health services at the household level. Each promoter is mandated to serve 100 homes and will be provided with basic equipment for household health screening. 100,000 community health promoters, kits, will be provided by the national government through the Ministry of Health, together with smartphones to make them reachable and to enable them transmit and receive necessary information, instruction, advice, and other information relevant in the delivery of health care by community health promoters. The national and county government will co-share the responsibility for the remuneration in the form of stipends for the 100,000 community health promoters who will work in each of our 47 counties, and I must thank our governors for this partnership. By launching the essential kits to equip community health promoters, we are making a bold statement of our intent to take a big step towards winning our nation's long-standing struggle for freedom from disease using a bottom-up strategy. This is also our celebration of critical victories in the struggle. Victory for citizens' well-being and freedom from disease, for devolution and collaboration between national and county governments, for the bottom-up economic transformation agenda, and most importantly, an immense victory for the people of Kenya. Shortly, Kenyans will no longer need to travel to a health facility for basic screening and the treatment of minor ailments, as well as preventative and promotive health care. Instead, health facilities in the form of these kits and the community health workers who shall operate them shall go to Kenyans and serve them at their homes. This is the essence of a bottom-up transformation of citizen services. I urge community health promoters and healthcare workers to serve Kenyans with zeal and motivation, and to be compassionate, respectful, gentle, and thoroughly professional. I urge them to remain focused on helping our nation win the struggle for freedom from disease. I also take this opportunity to express my appreciation for the patriotism of our county governors, whose dedication to this partnership has been exemplary. And I have made a commitment to our governors that they have my personal and they have the national government's support as they work tirelessly to make sure that we keep our country safe from disease. I want also to assure our county governments that they have our collaboration as we deliver to the people of Kenya. My commitment, the commitment of the national government, is for us to succeed as a nation. It doesn't matter who takes the credit. Whoever wants to have the credit, they can have it so long as we deliver public service and we deliver on this health commitment that has been elusive for many years. I also want to thank our members of parliament. They have been exemplary. They have worked with us. They have made a commitment. They have already interrogated all the bills. I am happy that they are going on with public participation in Turkana and in other areas. And I want to assure Parliament that the executive, both at the county and at the national level, will make sure when the pieces of legislation become law, we will ensure that we keep our part of the promise to make sure we deliver health at the very bottom to every Kenyan and be organized from the dispensaries to the health centers, to the sub-county hospitals, to the county hospitals, and also to the referral hospitals that we have across the country. We have legislation that will now underpin our health delivery systems across the country, in every county, and nationally. With this spirit of collaboration between the two levels of governance, only the sky is the limit, as they say. It is now my pleasure to launch the nationwide exercise to distribute 100,000 community health promoters kits to 47 county governments for further deployment. And it is my expectation that this partnership, this collaboration, and I want to thank our partners, UNICEF, Johnson & Johnson, CIF are a great partner to us. I want to specifically thank CIF for helping us with the kits that we have, their partnership and commitment, World Bank, Safaricom, and all the people who have made this possible. Each and every one of you have made an immense contribution towards what we are witnessing here today. The journey has started, and I am sure we will get there. Thank you very much. My very best wishes. I look forward to launching formally the next phase of this program on the 20th of next month. And I have asked the President of Angola to join us in that celebration so that he can help us formally launch this program that has learned many lessons, as Minister has said, from different countries, from different models. I want to thank the Ministry of Health under the leadership of my good Minister Susan. I have been on their case. We've had many meetings. I know sometimes I have put you under immense pressure, but you understand that my employers have also put me under a lot of pressure. So because you are my employers, because you are my employees, I report to these millions of Kenyans. So wao ndio wanasema hii kazi ifanyike na ifanyike haraka. So nawashukuru sana, pongezi. Nyinyi watu wa Kanairo, mjue tuko pamoja na nyinyi. Sasa nyinyi mtaenda kushughulika na kila county, na kila kijiji, na kila mtaa, na kila kona ya Nairobi. Na mimi naamini ya kwamba nyinyi mtatupatia heshima ya kufaulu kwa sababu tunawaamini. Ulisema kulamba tofu? Tunawalombo tofu. Hiyo kabisa tuko hapo. Sawa. God bless you and God bless our great country Kenya. Asanteni sana.
Asante sana Mheshimiwa Rais. We have only 3 more items that we'd like to do. The first one is a handover of the checks, where we would like to have you hand over. Kindly let's remain seated so that we are able to do this with your kind request. So we'll hand over the checks. The first check that is going to be handed over is one for 3 billion Kenyan shillings. And on this picture, I'm going to ask, for the sake of the photo, to have His Excellency the President, the Deputy President, the Prime Cabinet Secretary, the CS Health. Right, let's take it to the middle, right there. And have His Excellency the COG Chair, this is 3 billion. Prime Cabinet Secretary, the CS Health, Treasury as well. If we can have it in the middle. COG Chair. COG Chair is receiving it. We have the Nairobi County one coming. So if we can all just kindly look at the cameras at the front for the sake of that picture, then we'll have the second check, which is going to be handed over to Nairobi County, which is 221,160,000. So very good. And this is 221,160,000 to be handed over to Nairobi County government. Inaonekana haina signature, lakini itasainiwa. All right, for the sake of the picture, if we can kindly just look forward and have that picture taken. After that, Your Excellency, all right, Your Excellency, with your permission, would also like to have a special picture of His Excellency the President taken with the CHPs. I'll request that we put the umbrellas down. I'll ask His Excellency and His Excellency to join them there. Then we'll also have the governors later, but let's have His Excellency alone. Let's have His Excellency alone kindly to take a picture with the CHPs. Then after that, we'll have the Deputy President, the Prime Cabinet Secretary, and the governors who are here to join them. But for now, kindly let's just have His Excellency alone. Tuweke mwavuli chini ili tuweze kupiga picha moja na Rais wa Jamhuri ya Kenya. At this point, I'll also request that the truck drivers be in your trucks, ready to be flagged off. Truck drivers, let's get into our trucks, ready to be flagged off. But for now, we want to take the picture. Waimbaji wa West Pokot, tafadhali mje karibu hapa, mje karibu hapa. Once you're done, let me know so that we have the governors present who also join in the picture. Once we are done with that, let's allow His Excellency to come back this way, tafadhali, so that we may also do the official flag off of the trucks.
Simama, Wakenya wote simama. Simama, wewe shujaa simama.
Governors join in, please. Governors join in. Then after that, I'll request we all go back to the dais to witness the flagging off of the 47 trucks which are carrying the CHP kits going to all the 47 counties in Kenya. I'll request that we all come back to the dais so that we may witness the 47. There are 6 trucks that will be representative of the flag off. If we may allow His Excellency to come back, let's all come back to the dais, tafadhali. Let's all come back to the dais kindly. If we can kindly have the governors just line up here, but His Excellency on the red carpet. Governors, if we can just line up here as witnesses. The rest of us, please, let's come back to the dais. Governors in a line. His Excellency to flag off from... All right, let's all come back to the dais. So what we'll do, we'll count down. We're going to count down from 5. Then His Excellency will flag them off. And for the sake of safety, please let's not have the pyros. We're too close to the edge of the podium. So we'll count down to 5. All right, so we'll count down to 5, from 5. All right, so we'll have His Excellency flag them off. Then each county... Wait. Ngoja. Kwale governor. Hayuko. All right, we'll just count down to 5, then we start. And then we'll have the celebration. 5, 4, 3, 2, flag off. County 02. County 004. 004. Tana River. Higher next. Keep going. The next county is 006. Taita Taveta. Taita Taveta is there, so count Taita Taveta. And let's have Wajir County getting ready. Wajir County. After Wajir County, we have Marsabit. Marsabit pia jitayarishe. Marsabit. Marsabit. Yuko. Oh yeah. After Marsabit, we have Embu County. Embu Governor yuko tena sana. Embu County. After Embu County, we have 001. Mombasa County. Haya iendelee. Yuko. Kilifi County. Kilifi. Kilifi. Lamu County. Lamu County. After that it's Garissa County. Garissa County. After that we have Mandera County. Mandera. After this it's Isiolo County. Tharaka Nithi. Masaku is next. After that, it's Machakos. After that, it's Machakos. Makueni County after that. County 017 ndio imefuata Makueni. Makueni County. Followed by Nyandarua County. Nyandarua alafu Kitui, kwa hivyo Kitui karibu. Nyandarua followed by Kitui. After Kitui we have Meru County. Meru County is next. After Meru, Nyeri County, Governor Kahiga. After Meru, Nyeri County. After Nyeri, we have Kirinyaga County. Kirinyaga coming up next. COG Chair. After Kirinyaga, we have Murang'a. Murang'a County, Kachonjo. Twende, Murang'a twende. Kiambu after Murang'a. Kiambu after Murang'a. Kiambu ingia. Kiambu County. After Kiambu, Turkana. After Kiambu, Turkana. Turkana, West Pokot. After Turkana, West Pokot. Samburu, after West Pokot, Samburu. Samburu. After that we have Trans Nzoia. Trans Nzoia. Uasin Gishu County. Uasin Gishu County. Uasin Gishu County is next. Uasin Gishu twende. After that we have Elgeyo Marakwet. Elgeyo Marakwet. After Elgeyo Marakwet, Nandi County. Nandi County, ako wapi? We have Baringo County. Nandi alafu Baringo. Baringo County. After Baringo County, we have Laikipia County. After Laikipia County, we have Nakuru County. Nakuru County is next. Madam Susan Kihika. Nakuru twende. After Nakuru, we have Narok County. Narok County. After Narok, Kajiado. After Narok, Kajiado. Kericho County. Bomet County. After Bomet County, we have Kakamega County. After that, we have Vihiga County. After Vihiga County, we have Bungoma County. Bungoma. After Bungoma, Busia County. After Busia, we have Siaya. Siaya. After Siaya, we have Kisumu. Kisumu County. After Kisumu, Homa Bay. Homa Bay, Homa Bay, Homa Bay. Migori County. Migori County. After Migori County, Kisii County. After Kisii, Nyamira County. After Nyamira, Governor wa Nairobi, yako ndio hiyo. County 047. Na tukimalizia, sote tutasimama kwa wimbo wa taifa. Your Excellency, sir, we have come to the end of this particular occasion. So for now, let us be all upstanding to finish with a national prayer, which is the national anthem. We'll now allow His Excellency to retreat. Thank you very much.